Back in the workout studio, as I said earlier, and we're learning about rehabilitation. And we're here with Dr. Bobby Bennett. How are you?
I'm doing great.
Glad to have you back. Rehabilitation. Most people have a negative connotation about that. It's usually from a major accident, you got to rehabilitate. What's a better thing to explain rehabilitation?
So a better way to think about rehabilitation or rehab is to actually think of it as a retraining of your body. Now we're teaching your body to be more efficient at utilizing the muscles that you have, but also we're helping to prevent injury in the future.
That's good. So retraining and strengthening other parts of the body, maybe from lack of use also.
Absolutely.
So,
yep.
As we age, you know. So what do we have here?
So we're going to work on some retraining of the lower extremity today. So this is great for someone who maybe has had recurrent ankle sprains. Maybe you're coming back from a knee injury, a knee surgery, something like that. When you're ready to do, you've been cleared for rehabilitation. Okay. This is a great way to start and get not only the muscles to start firing, but also work on strengthening the ligaments in the joints. The ligaments are actually what stabilize the joints. So if we can strengthen those ligaments, we're actually going to have a more stable joint.
All right, let's do something. Show me what I have to do. I'm sure you're going to make me do something.
Yes, absolutely. So right here, we've got all these little pads here, and these are actually little balance boards. So they've got different density depending on so the color is going to be different. So this one right here is going to be our starting point. Okay. We're going to go to that, but actually before we even get to those, most of the time I'll have my patients start using the floor as their tool to start with because it's nice and stable. So if you've got a lot of mobility within the joint and you're trying to really strengthen it, starting on the floor, balancing on one leg is a great way to start.
So about what time frame? Because I mean, I can sit here for 3 or 4 seconds, but I mean, we have to have a goal.
Exactly.
So what are we looking at as we progress?
So someone who's really starting out, maybe I'll focus on having them balance for about 10 seconds, 5-10 seconds.
Wow.
Okay? And if it seems like you're losing your balance, it's great to have something to grab onto because obviously we don't want you crashing to the ground. But as you get better at this, you should be able to hold that for 30 seconds upwards to maybe 60 seconds and then get to the point where it's actually quite easy to do that balance.
Well, it sounds easier. Okay.
Once it's easy on the ground, and a lot of times I'll have my patients take their shoes off because the shoe does provide some stability. So if we're doing this barefoot, once it's easy on the ground, now we progress to some of our tools that we have in front of us.
Gotcha.
So we would start either maybe at the smaller end here or right over here. These are both going to have a little bit more density. Okay. The less dense they are, the harder it's going to be, right? So
I see, because the floor is dense.
Oh. So the softer it is, the harder it's going to be. So these two over here are going to be more challenging. So why don't we start here with the blue one in front of you?
Good idea.
Go ahead and step up.
Okay.
And we're again working on our balance. And you can see how your foot moves around a lot more than it did when you were on the ground.
Wow.
So what this is doing is it's forcing all those ligaments in your ankle and your knee to contract, and it's actually building up some stability.
And I can feel that in my calves too.
Absolutely. This is a great, and you can actually, if you want to work on strengthening your calves, you can do little calf raises on there.
Oh,
and
sure.
It's really going to exercise those calves.
We'll wait on that one.
So once this gets easy,
moly.
You can actually progress down to the next one here, which this one really has a lot of movement. So this one you definitely want to have a little something to hang on to when you start.
Hello.
Because most people step up and they fall right back off.
Wow.
But you can see how important it is to really find that focus and that balance on the foot.
Hey, you don't realize that's the smallest thing. Wow. As we get older.
So one of the complaints I hear from my patients is that they don't have time to do this.
Okay.
And consistency is really the most important thing when you start talking about retraining, because if we do it once a week, you're really not going to get the benefit from it.
No, it's pretty much a daily thing. You really need to, if you want to get some success and your goals, you guys should do something every day, I think.
Absolutely. Working on this on a daily, if not twice a day basis is really best. So what I'll suggest is for patients to take one of these, throw it under the cabinet in their bathroom. Okay? As you get up in the morning to brush your teeth, go ahead and pull it out. And 1 minute on each leg as you're brushing your teeth. You've got your 2 minutes of toothbrushing in, and you've got your rehab done all at once.
I see an injury happening. Just see it, but
that's why you get the counter there to hold on to.
You got the counter to hold on. Okay, I got you.
Exactly.
All righty.
So that's a great way to start incorporating into your day. Maybe you want to bring one with you to work. Keep it under your desk, take it out, and you can take a little break doing it at work as well. So it's easy to squeeze it in. Takes just a few minutes.
Okay.
So let's progress all the way to the end here. This last one, this is actually a wobble board, and you can see this actually moves on all sides. It's just got a round little area here in the bottom. And this is going to
Like-
be the most challenging of any of the tools we have in front of us
Like
because it really
Weebles.
moves a lot.
When I
But
was a
this
kid, we
one
had
you're
a
going to
thing
be on
called
with both
Weebles.
feet, exactly.
Whoa.
And so the
Okay.
goal initially is just to be able to stand on it.
All right, and then you want to.
And then once you can stand on
Progress.
it, you can progress and you can actually work on maybe doing a squat. Right. And you can
don't
feel how
realize-
you're activating your
just
core
don't
while you're
realize.
working. Good.
Oh my gosh. You just don't realize it. How much your body moves. And I can feel it all over.
And if you're doing this with your shoes off, you're actually building up the strength in the bottoms of your feet as well. And that's something that a lot of people maybe wear a big bulky shoe and they don't have the strength or the firing in the bottom of their feet. This is really
Wouldn't
great
advise
for
heels,
that.
right? No heels.
I would not advise heels.
Sorry,
Yes.
ladies.
Yeah, actually, I generally will suggest barefoot or
Okay.
just a simple shoe for a patient when they're starting out because we do really want to build the strength in the bottoms of the feet. That helps to prevent injury, and it also will prevent one of the most common injuries I see in feet, which is plantar fasciitis or tension in the bottom of that foot.
What about flat feet? That would be me.
This is actually gonna help you build up strength in the feet. Flat feet
there you
just
go.
means you have lost a little bit of that arch. This helps build up the strength in the bottoms of the feet.
Wow, so simple. And
Absolutely.
again, shouldn't be that expensive, but it's simple to do and it's good for the core. I
Absolutely.
could feel a little bit in there too.
Yeah, you get a little workout out of it.
Sure did. Thank you, Dr. Bobby.
Absolutely.
Appreciate it. This is good. Break my neck. I can just see it happening.